To get started, our first speaker is Professor Liz Halcomb. She's the Professor of Primary Healthcare Nursing at the University of Wollongong. She's speaking on the competency standards for nursing in general practice and international review. Internationally, primary care systems have been strengthened to provide management of the growing burden of chronic disease and provide health promotion and lifestyle risk factor reduction. This has led to a growth in multidisciplinary teams within general practice. A major barrier to teamwork in primary care has been role confusion and role ambiguity, in particular that relating to the nurse's role and potential scope of practice. This review seeks to synthesise the literature around professional practice standards in the context of nurses working in general practice. So I'd like to please welcome Professor Liz Halcomb.
Well, thank you very much and welcome everyone here this morning. Was anyone here yesterday when we did the workshop around competencies? Excellent, not too many of you. So basically what I'm going to do this morning is just give you a bit of an idea around the literature review we did around competency standards for nurses in general practice and primary healthcare as the first part of the competency project. We're all well aware that the nursing role in primary healthcare is growing. The role of the nurse is conceptually alluring when we think of the growing chronic disease burden in our society, the medical workforce shortages, and the demands of chronic and complex disease. But there's more to it, we all know, than just employing a nurse in a practice. We have to ensure that nurse can actually work to his or her full scope of practice, and there's a whole lot of workforce considerations that underpin that. Like any team, it's important that team members understand both their individual role in the practice and the role of other team members. And it's this mutual understanding that allows each member of that team to work to their capacity. So a nurse's scope of practice is defined in the various regulatory documents that exist and refers to the roles, the tasks, the procedures that a nurse is permitted to undertake in the clinical setting. Individually, a nurse's scope of practice is compacted by the individual nurse's education and clinical ability, as well as their demonstrated competency. The Nurses and Midwives Board of Australia clearly identifies what the entry-level standards are for registered nurses and enrolled nurses working in acute across all the settings. But the standards that we're looking at today are the primary care standards that sit on top of those generic standards. It's important before we go into this literature review to understand what it is that standards are used for. And standards can have a number of different purposes. Firstly, they can define our curriculum. So if we're wanting nurses in primary care to be prepared at an undergraduate or postgraduate level, standards can help define what kinds of things they need to be doing in that course. Standards can be used to assess student performance, unsurprisingly. Importantly, clinical practice standards can actually communicate to others what it is that's special about that particular professional group. And I guess perhaps the carrot for some people is that professional practice standards can actually be the thing that brings you undone in coroner's court if something should go wrong. So everyone, I think, has got a vested interest in making sure that the professional practice standards clearly and accurately articulate what it is you do, particularly if you're the one standing in the coroner's court. Hopefully no one will ever be there. So this project was funded by the Australian Government Department of Health and it's been currently managed by the Australian Nursing and Midwifery Federation in conjunction with the University of Wollongong as a research partner. It's an 18-month project that started in July last year and is due to finish in December this year, which is coming around a bit too rapidly. But there's a project team that's working on the project as well as an advisory and a reference group that includes a number of people who are sitting in the room today. And I thank them for their involvement. So the part of the project we're looking at today is the literature review that underpins the project. So we wanted to look at what the professional practice standards were around the world to see what are other people doing in the primary care space. We looked at peer-reviewed journals, we looked at the grey literature, and we also asked people to identify different resources or different documents they might be aware of. Anyone who's done a literature review in this area would realise that it's often quite difficult to find some of these documents and some of them are very, very well hidden. I was actually quite surprised at the number of professional practice standards we found in the literature. Unsurprisingly, the UK featured quite prominently. And from the UK, there are actually 3 sets of standards identified, which was a little bit interesting, I guess. 2 small studies have been undertaken by Webster and Sherlock, and these studies were basically local areas that identified that they had a need to develop some kind of CPD framework for the nurses working in their primary care settings, so they set out to develop standards to inform that CPD, which was quite an interesting take on things. But then in 2012, the UK General Practice Foundation published a very large document that purports to be their national standards. Unfortunately, the process that they went through to develop those standards is unclear, and the authors aren't very keen to talk to me via email, so I'm not very sure how they came about. So if anyone knows them, please let them talk to me. When I've shown nurses the UK version, they go, oh wow, this is really good. It's really simple to understand, it's really clear. The only issue is it's basically a list of tasks. It basically says that a nurse will take blood pressure, a nurse will provide assessments, and it kind of simplifies the nursing role down to a very basic level, which is interesting and it's good in some ways, but it also doesn't capture the intricacies of what you actually do in practice. This model has it follows Patricia Benner's model, so it moves from novice to expert, and it also has a set of core competencies as well as specialist competencies in areas such as chronic disease management and sexual health, travel health, and those kind of things. So it's quite a complex document, but it is very task-based. It purports to be linked to the GP curriculum, but it's a little bit vague as to how that occurs. New Zealand, unsurprisingly, have competency standards. They were put out by the New Zealand College of Primary Healthcare Nurses. I don't know if Barbara Doherty is in the room today. We had a brief discussion about it last night. Again, the development process of these competencies is quite unclear, and they're very broad statements. So in contrast to the UK that specifies the minutiae of what a nurse does, these are 9 very broad statements that in 9 statements describe the role. Interestingly, they identify 5 different levels of nurse, from a new graduate to a nurse practitioner, and at each level they provide advice about what kind of CPD someone might undertake to take themselves to the next level. So it's in that sense it's quite an informative model. Now the other countries that had professional practice standards were a little bit surprising to me, I must admit. Canada, I wasn't unsuspecting, but Thailand, South Africa and Brazil weren't on the hot list of places where I would have been looking for standards if I had to identify countries. In Canada, they reported an interesting project because it was actually run by a group of doctors. And immediately my hackles rose as I went, oh, these doctors have come up with standards for nurses. And then they wrote a very eloquent paragraph about how they'd tried to find a nurse, but no one would do it. So I thought that was quite interesting that these doctors had still, despite the fact they couldn't get a nurse interested in the project, they'd still gone ahead anyway. And they'd actually done a reasonable job. They did a Delphi study with only 27 people though, so it was a very small sample to get an idea about what they thought primary care nurses did. In Thailand, they identified a real need for professional practice standards because a number of their nurses were moving from acute to primary care settings as a result of changes to their healthcare system. So they interviewed 26 nurses who didn't actually all work in primary healthcare to come up with some standards for these new nurses to work in primary healthcare. In South Africa, they wanted a way to measure competency. So they wanted to know if their nurses who worked in primary care were competent, because they had a feeling that they probably weren't. So they developed a tool purely to measure how good these nurses were in practice. They actually went outside South Africa for their information and did an international Delphi study, getting experts from all over the world to comment on what a South African primary care nurse needed to have, which was an interesting take. And in Brazil, they've done a large amount of work in the area. Unfortunately, most of it's published in Portuguese, not in English. So there's only a limited amount of that that's actually able to be accessed in English language, so that was a bit of a challenge. So the data from those 4 countries really focused on primary healthcare nurses rather than general practice, but some of that's around the fact that general practice in those countries is quite different. So what were the competencies or standards that those countries came up with? Now, this is a very busy slide, but what it's trying to do is on each row, you can see that we've tried to to link things together. So the top row talks about integration, and you can see that all 4 countries actually, although they might have used different terminology, they really had something around teamwork, integration, collaboration, something along those lines. Obviously, providing care was seen as being important, and everyone had something along those lines. Professional accountability, South Africa hadn't mentioned that, but they talked about it in 3 other places. But things like being a lifelong learner, a health educator, and problem solving were things that weren't picked up in all 4 countries. So it's interesting to see that even though they derived these standards in quite different ways and in different means and in different settings, that they still had quite distinct similarities. And those similarities also linked to the Australia, New Zealand and UK standards as well. So from this review, we can see that there are similarities in the standards required of nurses working in primary healthcare internationally. The role of the nurse in primary care has the most benefit when the nurse works to the extent of their practice. Now, the benefits of a nurse working to the extent of his or her practice is not only that the patients are going to have better outcomes, but it's also that people are going to have more job satisfaction, which is going to improve our recruitment and our retention of nurses in the primary care setting. But to allow nurses to work right to the edge of their scope, it's vital that the scope is clearly articulated. We need to know what they can do and where they can go to. Beyond developing these professional practice standards, we need to work together to embed them in the culture. Because one of the things that was very clear from this review was that a number of these, all of the ones that were not the UK and New Zealand were published as journal papers, but there was no or very limited evidence that they'd actually been used in clinical practice. So the challenge for us as we move forward is how do we embed these in our practice so that it informs the way we work in Australia. Thank you.